Hi Ed, so we've been offline for a little while, supporting with the COVID vaccination programme. What we're going to do today is we're going to look at supporting primary care to embed personalised care in care homes. Something that we looked at, I think it's July last year, we did a briefing session, but I want to give a summary overview of that right now. And what I'm going to do is I'm going to talk about the context of personalised care support planning in primary care. However, this does relate to and resonate within any other sort of setting because the principles are pretty much the same. So when we talk about personalised care, really, what I want to do is I want to probably quote the wonderful Maya Angelou, who sadly passed away about seven years ago now. Maya Angelou said famously, "People will forget what you said, people will forget what you did, but people will never forget how you make them feel." Now, if there was ever going to be a sort of statement or something which would resonate around a framework around personalised care support planning, I think that would be one of them. It's very much looking at essentially what is it that matters to you. So it's personalised care support planning is around having a different conversation. It's focused primarily on what matters to you as a person, but it's all about recognising people that are the actual experts in their day-to-day life. And managing their health and well-being, whilst they might spend momentary periods of time with a health and social care professional, the majority of their life is spent processing thoughts on their own with their family and with their loved ones, and they're left to contend with the impact of their health and well-being on a day-to-day basis. So in that sense, they are very much the experts in their own care. We should treat them with that respect as well. So personalised care and support planning is a conversation around what matters to me as a person. It's the skills and strengths people have to use their experiences to focus on what matters to them. And it addresses things that might not be working in a person's life, but also identifies outcomes and actions to resolve them as well. So where does it fit in? Personalised care programme, which addresses things like being able to manage choice, ensuring shared decision making, looking at opportunities for supporting people with self-manage, hooking up to people to community-based support through things like social prescribing. So when we talk about personalised care support planning, it very much fits in what's called that comprehensive model for personalised care, and it features very, very strongly in the NHS long-term plan. Personalised care has already featured very, very strongly in the adult social care field for a number of years now. But the personalised care and support planning requirement also features in the primary care network DES, which is setting out the requirements for personalised care and support planning in a support package for care homes, where all residents of care homes that GP practices, or forgive me, primary care network support, they're expected to provide personalised care support planning. So what I'm hoping to do is I'm hoping that we can build on the briefings that we did in the summer, just to kind of remind and clarify what those requirements are as well. So for some context then, when we talk about planning, it's a term that's been used for generations now. We talk about care planning, but the approach of personalised care and support planning is a collaborative approach. It's person-centred, but it's not distinctly different. It's not about any of the things I'm going to talk about now. So it's not about developing a traditional treatment plan. It's not about that. It's not about doing something distinctive and separate from care planning. It's about just tweaking the way you go about doing your care planning now, making it more useful for yourself, more productive for your patients and for your carers. It's a process that's going to help with decision making about the best course of action for people. And it's not just about a single disease pathway. It relates to all disease pathways, but it will help in prioritising patients with particular conditions. So the care planning itself, the personalised care support planning, will take account of all of their physical and mental health needs, but particularly where people have got kind of very broad, complex needs that feed into lots of things around the wider determinants of their health and well-being. Things that you might not think of straight away in terms of a more kind of medical solution. So it's not a one-off 5-minute conversation either, far from it. It's something which can be prepared It's not something which can be prepared solely by a care practitioner, and it's not something that the care practitioner would do and the patient just agrees to. It's a collaborative process. It's certainly not a tick box exercise. It's not something that can just be copied and used for any individual, irrespective of their condition or a circumstance. But there is a template approach in which you can use to start to have more personalised conversations to ensure they get your best value. So, when we talk about personalised care support planning, what we need to think about here is there's probably going to be some key ingredients that we need to include in that. And there's 5 key requirements that are set out in the Primary Care Network DES. And what I'm hoping is when we go through these 5 key requirements, you'll start to get a flavour for, right, okay, how do we go about approaching personalised care support planning, and how does it actually relate to the way we plan right now for our residents in care homes? So firstly, people are central in developing their plan, and they get a chance to develop the plan and agree with it with a health or social care professional. And they get a chance to decide who's involved in that process as well, be it probably an extended family member or a primary carer. Secondly, people have proactive conversations about things that focus on what matters to them as a person. So it'll pay particular attention to their specific needs, but not just their medical needs, their wider health and well-being. So people, thirdly, will agree what their health and well-being outcomes are, and we're going to go into a little bit more about what we mean by that. So what they want to achieve, but that'll be in partnership with who's doing the care planning with them. Each person will have a shareable personalised care and support plan which records what matters to them and their outcomes and how they're going to achieve those outcomes. And then fifth, people are able to review that personalised care support plan at periodic moments in time, especially when there's going to be a significant change in the way that they might receive treatment that they need to be engaged in. So let's look at what kind of outcomes we might be thinking about here. These are some of the typical things that have been included in care plans that I've seen, that colleagues have shared with me. So one of them might be, I want to have a good night's sleep. I would like to walk or be physically fit enough to walk my daughter down the aisle by the autumn. I want to stop taking antidepressants because I don't really like the side effects. I want to learn how to cook a healthy meal on my own. I want to have the same person caring for me in my home. And then another one that I've noticed is around community-based support. So someone saying one of their goals is to meet new people and find someone with a shared interest. So the interesting thing about those examples are they're all from the individual's perspective. None of them are medical. None of them are what you would typically see in a kind of medical care plan. They're all very personable and they're all very individual. They're all things that matter to someone. And you'll only find out what those things are by having those types of personalised conversations. So it's really, really quite easy and straightforward. And what it does do is it helps the broader plan, so the more conventional, clinical, medical things, it gives them more perspective, it gives them more meaning. And there's loads of evidence to suggest that actually the whole process of care planning is going to be a lot more productive, and it's probably going to work out and deliver better outcomes for your patients and carers, but also make your life as a health and social care practitioner a lot better as well. So I'm going to talk now a little bit about broadly what the plan might include. So how do you go about finding out what the answers to those questions are? There's probably 3 key things that we want to consider here. One, the plan needs to include something about me as a person. It's about me. Secondly, what might you need to support me? Or what support would need to be in place to support me? And thirdly, what's important to me as a person? There's 3 key things. Something about me, a chance to talk about what you need to do to support me, and then thirdly, what's important to me, or what matters to me. So a little bit more meat on the bones there. So the plan will look at things around, if it's looking at what's important to them, it's about setting goals that they want to work towards. Things that they can do to live well and stay well, or for some people it might be to die well. Things around what support they might need to self-manage, and agreeing a kind of key set of actions about what they can do to take forward that themselves, and what actions others will take in their care plan to help them realise those goals. what care and support they might need from others, and how that best fits around their life. What good support looks like, preparing for the future, including making any choices and stating in advance any preferences for care that they might well have. And in some cases that might be pertinent to how they might choose to end their life respectfully and with dignity. Whatever's relevant and what's appropriate to the person's circumstances. So, what could you do next? So, there are some tools I'm going to show you, but broadly, I suppose this is about taking what you might have learned from the session, if you did attend the session back in July, but taking from this blog today something to pass on to your colleagues in your primary care network, and that could be within your own practice or with your colleagues in your care homes. There are some training offers that have come out of there that you could engage with as well to help you to kind of make this more workable. And there's lots and lots of resources that are shared in the link below to this video. But I suppose the next practical step you could take is to look at your existing advanced care plan with your care home and think about, right, okay, does the things that are in this template, do they feature in there? And are we confident that those conversations are happening on a regular basis? And what can we do to test that? And yeah, work in partnership with your care home to test the best approach. It's not something that you would want to do on your own, because your care home will probably have an advanced care plan in place already. And what we need to do here is just to make sure that that reflects the best practice approach for personalised care and support planning. So obviously there's support from myself as well. If you want to have a conversation with me about how to embed it, I'm happy to have joint conversations with your clinical leads and with your care homes about how to go about embedding this process to get the best possible value. There's obviously in the link to the slides below that will be shared after this recording, there's links to the service spec. The Primary Care Network does service spec, which sets out the whole context about why it is you're supposed to have this in place. But then the other support is in the pack that we're shared in the link to you as well around the practical guidance. There's some case studies as well in that link. Lovely narrative from nationalvoices.org.uk that goes some good examples. But if you look online, the references to this are available on a mass scale. There's so much evidence out there about the impact it has. It's just a good thing to do. It's a caring approach to take. It works really, really well. And it's going to help you fulfil those key requirements that are expected from you in that primary care network days. And I think it will also make your role day in, day out a more enjoyable process when actually undertaking your care planning. I think you'll get a lot of value out of it. So yeah, if you need any help or guidance or anything like that, give me a shout. My email's in the link below. The toolkit, the slides around this are also in the link below. But yeah, good to see you. We'll see you again. I hope that was helpful. We're going to try and make more vlogs going forwards if we've got the capacity to do so. But yeah, thanks for listening and cheers. Take care.